in. Today is just a day we're going to address any questions that you might have. I have a whole lot of stuff that I'd like to share and talk about from a research standpoint and some different topics. 480-745-1033. There was a study that just came out that talks about just lowering fat. People that want to lose weight, you don't have to diet. Just decreasing the amount of fat in your diet tends to be probably one of the most successful ways. And I really, Joe, would like to talk to you about that because you were sharing with me your story.
Absolutely.
What was it, the creme brulee incident on Thanksgiving?
The creme brulee incident on Thanksgiving. And what had happened was I was really watching what I ate because I think, the holidays, I can gain 14 pounds by smelling food.
Right.
So I'm like, I just got to be really careful because I don't want to get any fatter, holy cow, I feel like crap, right. I want to lose weight. So I'm thinking, people say it's the hardest time, I'm going to go for it. So eating just a little bit, feeling really good, feeling great. The next day after Thanksgiving, it was the morning, and my wife said, Joe, you haven't had any real sweets and stuff here. You got to try, it's from Whole Foods. Right. You got to try this piece of creme brulee pie. Mm-hmm. She literally brought me a piece this big. I gotta show people. I mean, I'm talking about smaller than a Twinkie.
Okay.
Mm-hmm. Man, it was good. I ate it. Within a half hour, I started going, man, did somebody turn the air off in here? I started having a sweating attack, and then I started turning flush. Mm-hmm. And then I started to shake, and that's when I went, I think I'm dying. I think I'm having a stroke. I've been through enough shows where I definitely have a medical problem. What's wrong? So I sat there and tried to relate. It took me like all day to shake it off. My blood sugar went through the roof. It was awful.
Right. As a diabetic,
horrible.
That's something you have to be careful.
And it scared me bad.
And, one of the things that I really want to talk about is the olive oil. I mean, since we had the olive mill on the show, you've made some lifestyle changes.
And I'll tell you what, it's been amazing because I didn't say anything to you. It was something I heard you talking about, and I thought, well, if it's that healthy, I might as well try it. I happen to we have 2 or 3 bottles because we get olive oil to cook with. Right. So where we tried it first was we got a baguette and we made some, the tomatoes and the basil and the, what is that called? Bruschetta. And how we did it was we took the olive oil and we just brushed a little bit on each piece of the baguette that was cut up and we put it on our George Foreman grill and grilled them, and they were nice and it tasted great. And I'm like, wow. So then we tried it cooking with eggs, and we haven't had butter in a good 3 weeks.
And you're down how much? How many pounds?
I don't even know.
Okay, so you haven't even gotten on the scale. That's good.
I haven't even gotten on the scale.
But your clothes are fitting,
I
right?
tried some clothes on I've been wearing in 3 years, and they were loose. Perfect. And because Marie said, you've been losing weight, try this. Thought for sure I was going to have to buy a new outfit for the weekend. Right. I was shocked.
Good. Well, congratulations. The message really is, get away from the whole mentality of dieting and just make some lifestyle changes.
Well, I also started doing my elliptical, and I started, believe it or not, this sounds really dumb, 1 minute I was done. I'm like, and I was even embarrassed in front of Marie. I'm like, 1 minute. I'm like,
right.
Wait till she turns around and get off and run in the back room. And it took me about 4 or 5 days before I could get up to like 3 or 4 minutes. Well, now I'm up to 11 minutes.
Fantastic.
Twice a day. And because I learned on your show that I always thought you had to raise your cardiovascular for 20, 30 minutes to be effective. Well, when you said that you could do it twice a day, I thought, well, you know what? Maybe there's a chance.
Absolutely.
And I am feeling, now I'm walking my dog 2 miles 5 days a week.
Joe, that's fantastic.
And I'm enjoying it. I feel so great when I'm done. It's like I have a lot more energy to just do whatever I want before to be like, I'm done for the day, I'm done.
Right.
Now I have
You're
energy.
more alert.
Right.
We know that brain power.
Thinking better.
Absolutely. Studies just come out looking at brain power is dependent on your physical activity.
And my diabetic numbers, I am a type 2 diabetic because of living the good life. It has nothing to do with anything else.
Right.
They've come down about 30 points across the board in three weeks.
That's fantastic.
And no difference of medication, no difference of eating besides the olive oil and the exercise. That's the only change.
That's a success story. And, as a physician, that's what we
and
strive for.
I'm not there yet, obviously, but I'm just going to keep what I'm doing, hopefully get up to about 20, 25, 30 minutes on that elliptical.
Right.
And, once I start getting over the hump where I'm really noticing it going, oh, my God, I'm sure that'll motivate me even more.
Absolutely. The more you move, the more exercise, the more you're incentivized, you feel better. Serotonin levels go up. We talked about that before. So that's fantastic. Today what I want to do, again, invite anybody that is listening.
I'm going to turn them on now.
Turn on the phones, call in 480-745-1033. I want to talk about, first of all, I want to just talk a little bit about some of the new research that's out. This week, in residency, when we were going through training, there was a lot of talk about sleep deprivation in physicians, and whether or not there's a risk to the patient. Well, a study just came out. It was a 10-year study looking at cardiologists back out of Geisinger, back in Pennsylvania, who did cardiac catheterizations from 11 p.m. to 7 a.m. in that time period. And they found, interestingly, that there was no significant complication rate increased with docs that are sleep deprived. And I think that's kind of an interesting tidbit to know, because we were always under the impression we couldn't, in residency, we weren't allowed to work over like 16 hours a day, or there were some restrictions because sleep deprivation impacts mentality and the ability to concentrate. But it's interesting that in real life, in what we see day to day, that there's not a decrease in patient risk or safety, and I think that's an interesting study. Another great study that just came out is looking at crowded emergency rooms. And that really hits home with us here at Gilbert ER. We have a door-to-doc in 31 minutes, and we've talked about really essentially no ER wait in our hospital. But a study looks at when you have a crowded emergency room, there's a significantly higher increased risk of mortality. Patients do worse. There's delay in treatment. The inpatient side, they end up staying in the hospital for 1 to 2 days longer. So it really does make a difference in trying to get into the emergency room in a timely manner. And now that the season here in Arizona, we have a lot of snowbirds that come in, it can be a problem. So I just wanted to, kind of put that out there. Living longer, but sicker. Study comes out showing that there's no doubt people are living longer, but people are living sicker. The incidence of obesity, hypertension, diabetes is off the chart. And we were just talking about that just a minute ago, about lifestyle change and the importance. So a lot of stuff coming out from a research standpoint is really directed toward lifestyle change, diet, exercise, decreasing the incidence of dementia and Alzheimer, which is linked to increasing exercise and activity.
And this should fit right in. Lillian from Gilbert says she didn't think it was possible, but is it, to get off the type 2 diabetes pills with change of diet and exercise? Is that possible?
Absolutely it is. Absolutely
Wow.
it is. In fact, we see it often. One of the things that you have to look out for, if you do start an exercise program, I have patients that start in like a slow exercise program. Maybe they get into a yoga class or, something like that. In addition, they go to diet classes and our diabetic educational classes. One of the things that I get a call about often would be that their sugar's dropping too low. So you've got to be very careful that when you're on the medicine and you start making these lifestyle changes, it absolutely changes the metabolism.
Bottom line, continue to check your sugar twice a day at least.
Check the sugar a lot, but the ultimate goal is to get off of that medicine.
Oh, that's great.
The problem is that if you're still taking it and you're in the midst of it in real time, your sugars are going to drop. And you just have to be cautious of that. But
what do you look for when the sugar drops too low?
That's a good question. And what happens is you tend to see decreased mentation. You tend to get where you feel cloudy, or people, actually, you don't really recognize it yourself. A lot of times people whose sugar drops low really may not know that their sugar's low, but they become sweaty. They become a little bit more lethargic. Their walking becomes slowed. In fact, it's one of the first things that we do when we see somebody that has kind of stroke-like symptoms, or, they're just kind of glassy-eyed, not responding. A low sugar is probably one of the most common and the easiest things to fix.
And again, if you don't mind me asking, what are the symptoms of too high of sugar if somebody's not aware?
A lot of times too high sugar is asymptomatic. You don't really know that your sugars are high. We have people walking around with sugars 400, 500 and not really know it. So
Wow.
From a symptomatic standpoint, we always say, I would rather have you a little sweet than too low, because when your sugar drops low, you can go into, kind of a coma state, if you will. When the sugar goes way, way, way high, certainly you can get into that coma state. But usually people can walk around with high sugars and just never know it. You just don't feel it. It's not painful. those are the things. Increased urination, increased thirst. Those are the things that we see with high sugars
That's
that are
what
out
I
of
found.
control.
That's what happened when I realized that I had to succumb to this
Right.
terrible. What do you call it?
Diabetes. It's a diagnosis or
what is it
condition.
called? It's such a disaster across America. I can't think of the word
It's an
right
epidemic.
now. Epidemic. That's
is.
what I was looking for.
There's over 30 million people with diabetes. But, people can have low blood sugar and not have diabetes. And, for example, there's situations where people have had tummy tucks. They've had, gastric bypass. And, after a very high starchy meal, what happens is the way that the body works, the pancreas spits out this insulin, and the food doesn't hang around very long in people that have had gastric bypass. So it moves through quicker, kind of like a dumping kind of syndrome. But yet there's that insulin burst, and what happens is it drops the sugar. And that can be an issue. So, we can see hypoglycemia, low blood sugar, in people who are not diabetic, but in people who have, these other symptoms and history of, for example, gastric bypass and those kinds of things. So getting back to the question, the goal absolutely is to get off of the diabetic medicine. I mean, that's the goal. And the way that we measure that is what's called a hemoglobin A1C. It's a blood test. And it's a blood test that gives us an idea, not just a snapshot in time, but it gives me an idea of how your sugar has been controlled for 3 months. And what that tells us is that, diabetes is not something that you fix immediately. It's a chronic condition. Once you have it, you have the tendency to have diabetes. Even if you're off of the medication, you still have to maintain that lifestyle change. And so the hemoglobin A1C is a test that we do, usually on the outpatient basis. It's really not an in-hospital kind of a test, that gives us an idea of how the sugar is controlled. So let's say you say, well, yeah, the last week I've been good, I've been taking my medicine, and and your sugars are good for the past week, but
doesn't matter.
It doesn't. It really is the long-term effect of the glycosylation, the increased sugar in the blood that continues to flow through the vessels.
What does it show? A swing by percentages?
It's a percentage. That's exactly right. In normal, we like it to be less than 6%. I've had people with hemoglobin A1Cs close to 15%, and that's a disaster, because what that is directly related to is increased problems with the eyes, with kidney, and with heart. And so when you have an ongoing hemoglobin A1C that is greater than 10, close to 13, 14, 15, the incidence of you developing kidney failure and ending up on dialysis is very real, or developing blindness, for example.
Diabetic retinopathy, flame-like hemorrhages. It affects the vision that is irreversible. It leads to blindness. And so that's why we get so aggressive in trying to control the sugar. So for those listening, the ideal blood sugar is between 80 and 120. And so if you're diabetic and you say, well, my sugars are 180, 160, and for me that's great. Well, that's still out of control. So we really have to get more aggressive in controlling it, mainly not because of the number, but because of the effects that can have on your body over long term. And so that's very important to know. Same thing with blood pressure. People say, well, my blood pressure normal for me is 130 over 90. Well, that's not normal. On the back end, right?
On the back end, even on the front end, even the systolic. Because, we know now out of the American College of Cardiology that we have to be more aggressive in managing our patients' blood pressures. 120 over 80 used to be the norm. Now that's considered pre-hypertension. So we want it to be under 120, and we want the lower number to be under 80. Because we found that people do better, they live longer, the risk of stroke is significantly decreased. And those are the things that we're interested in helping to promote health and well-being.
I can't tell you how many calls I had during the week, people asking about toothbrush care.
Oh, really?
After our last show.
Mm-hmm.
I talked to this one lady for like 35 minutes about, it just turned into a conversation,
yes.
But, people washing their tooth. One lady says, I'm never putting my toothbrush in the bathroom again. Mm-hmm, mm-hmm. But that was a big thing, and maybe we should just quickly mention that.
Yeah, that was for me, that was a game changer show. We talked about the Olive for You. It's important to maintain dental health. There's no doubt about it. And I think even within ourselves, I have a sonic toothbrush that it sits in my closet. After last week's show, it's out, and it reminds you that we have to be active in taking care of our body.
Right.
And our teeth is very, very important, because dental care translates into systemic disease. if you have poor dentition, gingivitis, periodontal disease that we talked about last week, there's a direct correlation between that dental bacteria getting into the bloodstream, setting up an infection in the bloodstream, in the system, increased inflammatory factors, and then leading to coronary artery disease and those things.
So I took my dog Angie, who's 9 years old, bull mastiff. Usually they live 11, 12, 13, not 25 like little dogs,
Right.
but she had congestive heart failure about 5 months ago. They gave her a month. And I've been diligent on these pills and, just taking her off the people food and
Right.
brushing her teeth. After that show, I'm a little extreme. I set up an emergency visit. I went down there to have her teeth checked.
Did you really?
So she has periodontal disease. So I've been brushing her teeth now
Interesting.
every day.
That's great.
And now I can floss some of them, and she's cool with it.
Wow.
And I'll tell you, she's been living now 5 months.
Wow.
They gave her a month, and she's been living 5 months, and she seems to actually be feeling
doing
a lot better.
That's great.
So,
That's,
it's probably the pills, but,
right. I'm sure it is, but it's everything put together. Yeah,
and she had the worst breath ever. Now it's not too bad.
That's what I was going to say. It really does affect that as well. Yeah, very good. Do you have another question there, Jim?
We had another call. Charlene from Phoenix says, I get sick constantly from my 6 kids that are in public schools. Is there something I can do as a preventative?
That's a great question. Usually this time of year, kids bring home things, people, kids in daycare, those kinds of things. What you want to do, Charlotte, is you want to try to maximize and boost your immune system to the best possible. And the things that I would recommend, number one, get rest. Get plenty of rest. Sleep is absolutely vital for the immune system. Vitamin C actually has been found to be very helpful and beneficial, for the immune system. So I would get some vitamin C, take, up to 1,000 milligrams a day. Keep lots of fluids in your system. We're going to be exposed to viruses no matter what. The other thing to keep in mind is to wash your hands and be constantly diligent about that kind of hand washing, because that's how we oftentimes transmit infection. So at home, make sure that the kids have an access to washing their hands and keeping yourself healthy. But those are really the things that I would recommend. If you're a smoker, the smoking decreases the immune system, so obviously that's not a good thing. But those are the things that at the top of off the top of my head. Echinacea, some of these other things that you see in the store, there's really not a whole lot of literature and studies showing that does help, with the immune system. If you do get exposed, there's some studies showing that it decreases the viral shedding, meaning that you won't have such a severe or long-lasting viral syndrome. So that might not be a bad idea. Personally, what I do is I keep in my pocket those little cough drops that are vitamin C cough drops, because I'm in and out of patients' rooms and that I'm treating with pneumonia and bronchitis and influenza and all of that. So that's just one way that I think is something good to just kind of keep in your system vitamin C. Keep hydrated and rest, and those are the big things that I think. I want to just talk about, while we're talking about infection and so forth, there was a question that came up in terms of influenza shot versus the inhaled mist. And now, I don't know if you're aware of it, but there is a way to get the influenza vaccine by inhaling it through a mist. And the recommendations, they're not indicated for children under 2 years of age, nor is the mist, it's an inhaled spray, recommended for the elderly population. The recommendation is from age 2 to 49. And, if you're in that age group, it would be fine to get the inhaled nasal spray, which is a one-time in place of the flu shot. So that's just another, something else to think about. If you haven't gotten the flu shot, that is recommended. And it's not too late to get the flu shot either. Today, couple topics that I want to talk about: asthma and emphysema. A lot of people get confused about what is asthma, what is COPD, and I want to just kind of talk a little bit about the differences. Asthma is a reactive airway process. In fact, a lot of people think that in order to have asthma, they have to have it for years, and childhood asthma oftentimes translates into adult asthma. I can tell you that asthma can occur at any time, whether in childhood, in adulthood. You can have a bronchitis that can give you asthma-like symptoms. But the good news is that asthma is a reversible reactive airway process. It's bronchospasm caused by some trigger, whether that trigger be exercise. Sometimes you can get an exercise-induced asthma. Sometimes you can get a cold-induced asthma where you're out in the cold air and you inhale that air.
Secondhand smoke?
Secondhand smoke can be an exacerbation of asthma. And basically what it does is it causes the bronchial tube to go into spasm. And that's why people wheeze, they have a hard time breathing, and a lot of times the breathing is on the inhale. When you inhale, it's like, you just can't get enough air in because as the more you inhale, the more bronchospasm occurs.
And that's a terrible feeling.
It is a terrible feeling, but it's reversible. It's not something that is what we mean chronic in terms of affecting the lung parenchyma. It doesn't cause lung damage. It's just a reaction, a bronchospasm that is reversible. You inhale the albuterol or nebulizer, the treatment. You get an antibiotic. You stay out of the cold. Stay away from the smoke. Remove the trigger, and the bronchospasm usually goes away. As opposed to emphysema, which is more of a chronic obstructive airway disease caused by smoking, caused by asbestos, caused by a lot of pollutants and a lot of different environmental things, that is a structural, irreversible process in the lung. So once you have that, a lot of times it's not curable. It's just something that we treat.
Those are the people we see mostly walking around with oxygen stuff and tanks.
Exactly. That's right. And what happens is it's more that they can't get air out. So they can inhale, but they don't have the force to get the air out. So they develop what's called this barrel chest, and you can see kind of, if you look at somebody that has end-stage, lung disease, their structure looks a little bit different. Very skinny legs, but their chest is a little bit more barrow-chested because of the inability to completely exhale the air. It's an interesting structure.
It's funny you said that. I can think of a guy who was here working on my telephones that had that, and I noticed, I'm like,
yep.
Wow, he looks a little odd.
Yes.
And he passed away.
Did he really?
With heart disease.
Yeah. There's a big
I
strain.
couldn't believe it. I was shocked.
In people that have chronic underlying obstructive lung disease, it strains the heart. Obviously the heart and lungs work close together. But I just wanted to kind of bring that out because there's a completely different pathophysiology between asthma and obstructive lung disease. You have a question?
Benjamin from Louisville, Kentucky says, isn't the increase of grease or oil, even olive oil, counterproductive to health in general? What about to fry with?
Okay. The answer to that is olive oil is a good fatty acid. It's a polyunsaturated fat. So, it's the saturated fats that you want to stay away from. Lard, the butter, the highly saturated fats. And what happens is the body deals with it completely different. The molecular structure of the polyunsaturated fat that's found in olive oil acts almost like a flush. It helps to flush the body. It helps to flush through within the arteries and decrease plaque buildup. So there's actually been studies looking at olive oil being beneficial in people that have coronary artery disease. So it's just the opposite of what you're saying. Yes, certain types of oils, saturated fats are not good. It just builds up the structure. The molecular structure is a little bit too big for the body to be able to metabolize. But olive oil has been found to be very, very beneficial.
I wonder if you can fry with olive oil.
You can.
You can?
You can. Absolutely, you can.
It's just a little more expensive.
It is.
But I'm sure it's worth it.
You can fry eggs. I mean, there's a lot of different...
We cook eggs in it for sure, and it tastes delicious.
Yep.
And at the olive mill, they've got 78 flavors or whatever of olive oils, so you can get something to...
Right. Just purely from a health standpoint, I can tell you that the polyunsaturated fat is a beneficial type of fat. Interesting, there's some studies looking at the mid-chain type fats, like coconut oil. Historically, we used to think that coconut oil was a saturated fat that had bad health side effects. Well, I can tell you now that the research shows that coconut oil and the fat that is found in that type of oil is beneficial for the body, and actually has been found to actually reverse and slow down the process of Alzheimer's dementia in the brain. So there's a lot of interesting data coming out now looking at the different types. All fats are not the same, and that's important to know.
I did one other change that I never told you about. I went twice a week, and me and my wife both do it, and the kids too. Twice a week, we eat for dinner a big spinach salad with the fresh spinach leaves, and it's delicious.
That's great.
And I'm not a salad person, but I've gotten to really. I have just learned when you're really hungry. My God, things taste good, even if it's something you don't normally eat. That spinach tastes like gold when you're starving.
That's good. That's right.
Right.
Increasing vegetables and fruits, the best thing that we can do for our brains and our bodies.
We're about to start juicing with our Vitamix we've got over there. So we're going to start doing the fresh juices.
There was a question not long ago on the show. Somebody asked, what is the difference? Is juicing as healthy as eating fresh, and you do get the vitamins, you do get it, but just keep in mind that nothing replaces actually eating fresh fruits and vegetables. I mean, the bulk that you get from eating an orange, for example, versus the juice from the orange, there's a lot of beneficial vitamins and phytochemicals and antioxidants.
But if you take that fresh orange and put it in a blender, why would it be different than eating an orange?
Well, as long as you're getting the pulp. It's the pulp.
Gotcha.
It's the pulp that you want, because the pulp actually has a lot of nutrients that we don't realize. That just leads me into talking about resveratrol. When you look at grapes, for example, in the skin of the grape, it is really power-packed with antioxidants, something that's called resveratrol. And that's really what is responsible for the health benefit and the antioxidant effect in wine, in red wine. There was a study that I was reading just recently about the treatment of prostate cancer and how resveratrol now has been found to actually increase the efficacy of radiation in people who get treatment for prostate cancer. Now, I got to tell you, that's huge, because the medical mainstream research that's coming out now, in the New England Journal of Medicine and the Journal of American Medical, you can, in the main medical journals, they're looking at the antioxidant effects of fresh fruits and vegetables and all those kinds of things. And it's really very, very interesting.
We've got a little bulk of questions added up here. So if you guys are calling, just hang tight, let that phone ring, and I'll be getting to it in just a little bit. First of all, I have heard that asthma is brought on by dairy products with children. Dairy is a mucus-causing agent. What are your thoughts?
Okay, that's a really good question. Anytime I have somebody that has a history of reactive airway disease, we recommend to avoid dairy. And the reason, dairy, unless you have a food allergy, is not going to necessarily bring asthma on, but it's going to do exactly what you said, and it's going to decrease the amount of mucus production. If you think about it, in the lining of the bronchial tubes, there's little hair-like projections. And that's responsible for helping to clear secretions. And so if you have inflammation, if you have bronchospasm, mucus can build up, and that's part of the process. That's part of why it's so uncomfortable, because you're coughing, you can't get the mucus out, and then milk products actually increase the production of mucus. And so we recommend staying away from that. So yes, you're absolutely right.
And ironically, and I never knew this because I am not a milk drinker, but, there's a lot of other things with dairy. And then, being that I've been on this kind of strict regimen, I'm not on a diet.
Right.
I'm just on this regimen. Last night I had a hot chocolate with sugar-free, but I made it with milk because with water just stinks.
Right.
And I was congested.
Yes.
After about an hour and a half, I felt like, what the heck?
Some people develop what's called lactose intolerance. It can cause bloatiness,
Since
diarrhea.
I hit 40, I'm getting everything.
So those are the
Knock on
things.
wood.
Yeah, but there's other things that you can substitute. Almond milk is a great substitute. It's very natural.
We're going to Costco today to buy soy milk.
It's a great substitute.
Is almond better?
I think that almond
better.
is. Yeah, I think that almond is probably healthier. It has the omega-3 fats.
I'll look for that.
Again, which is a good type of fats. Yeah.
My Linda from Florence says, I take 5,000 milligrams of vitamin C per day for the last 7 years. Haven't been sick in 5.
Yes.
Do you think it's good? I was recently told to cut down on my vitamin C by my primary care physician.
Yeah, I probably would. Let me just tell you that there's 4 vitamins that I would be careful of. Vitamin A, D, E, and K. Those are the fat-soluble vitamins, and those vitamins, if you overdo it, you can become toxic. So we definitely recommend that you stay within the guidelines, taking vitamin A, vitamin E, those kinds, vitamin D, vitamin K. Vitamin C happens to be a water-soluble vitamin. So really, the more you take, if your body doesn't need it, you're going to excrete it.
And just maybe turn orange.
And you might, exactly. That's, but... actually, orange is the more of the carotene. We can talk about the beta
Gotcha.
carotene because we do have people that actually turn orange because
Oh,
overdoing
they really
it.
do. I was just kidding.
And that's vitamin A.
Oh, wow.
Because it tends to sit in the fat tissue. But vitamin C, literally, you're going to urinate. You're going to urinate it out. But 5,000 units a day. I mean, it's good. What happens is your body then becomes a little bit more dependent on it. So I wouldn't cut it completely. I'd probably go down to maybe 2,000 a day. If you're doing fine and you feel fine on it, what would the other reasons be? Well, if you precipitate making kidney stones, sometimes there's some talk about vitamin C in people that are stone producers. You can exacerbate that, so I'd be careful.
The chewables just taste so good, huh?
Make sure that you're hydrated. Keep yourself hydrated. And, it's the expense of it, too. So, you really don't need that much.
Gotcha. Let's see. We'll go up to the chat. So frying in vegetable oil at high temperatures is considered okay?
Well, olive oil, yeah. I mean, it's interesting because there was a study out looking at like French fries and frying in the high temperature. So I guess my recommendation is fried foods I tend to avoid. Whether you fry it in...
No matter what you fried it in,
No matter
right?
what you fried it. Because there's some talk about a carcinogen effect in the frying process. So if you're going to fry food, it's always better to do it in polyunsaturated versus saturated. But avoiding fried foods would be the best altogether. Stay with broiled, stay with those kinds of things. Eat, a baked potato versus, fried French fries and those kinds of things.
Those cyclonic air ovens are wonderful, too, for air frying things where you don't need the grease.
Mm-hmm. And that might be good. But purely looking at the incidence of cancers and those kinds of things, there's some studies out looking at that. And I've, when I read that study not long ago, I said, you know what, probably I've eaten my last French fry, because
Wow.
because it impacts you, and it really made me think, why is there such a high incidence of these cancers that we're seeing, breast cancer and all these different things? I think it has a lot to do with our lifestyle and what we're putting in our bodies. Pesticides have a lot to do with it, So, it's a hard sell, but if you're going to fry, polyunsaturated is better than saturated. But my recommendation, if you really want to get into a healthy lifestyle, is to avoid frying altogether.
And there are just so many different ways of baking, and I mean...
Mm-hmm. Joe, the bottom line, I think, is it's an investment in your health. I mean, it takes effort. It really does take sacrifice. It just depends on really the pros and the cons and what you're willing to sacrifice for good health. We know that exercise is good, but, right now we know that 29% of the entire adult population don't exercise. So it's just really a matter of deciding whether or not you want to invest the time and the effort in helping preserve health, because there's a lot of things that we know now that should be done.
Bertie from Florence would like to know, where do I get the mist instead of the flu shot?
Yeah, that's a good question. And I think a lot of the drugstores might be giving it. The hospital, we had to get the flu shot, and the only flu shot that was offered to our staff was the shot. But you may want to call the pharmacy, maybe call your primary care doctor and find out, if the mist is available. I don't know if it's covered under insurance. I mean, so there's a lot of different question marks that come with it. But it is available. It is FDA approved, and it is effective. Again, just keep in mind that it's not recommended for anybody over the age of 50, and it's not recommended for people with chronic underlying illnesses like kidney disease, underlying heart disease, underlying lung disease. That's the population that really should get the flu shot, is people that have chronic, underlying medical conditions. So, it's new, it is effective, but there's just some things that you have to be aware of. I know we have some other questions. I want to talk a minute about tennis elbow. This time of year, a lot of people are putting up Christmas decorations, and there's something that we call epicondylitis, and it's an inflammation of the area around the elbow. There's the medial epicondylitis, and there's the lateral, which is just simply inside and outside. And even if you're not a tennis player, if you do a lot of heavy lifting, boxes, just kind of repeated movements by putting decorations up, we've seen a few patients come in who've developed the symptoms exactly like tennis elbow with no history of playing tennis. And so, just be aware of that. The way that we recommend treating it, it's a conservative treatment. Obviously, you want to avoid that recurrent heavy lifting activity. Anti-inflammatories, ice. Absolutely, ice is important, even if it happened, 2, 3, 4, even a week ago. Ice is really what's recommended. And there's something called a tennis elbow band that really sits on the forearm. And the symptoms of tennis elbow simply is pain radiating down the forearm. And it's kind of like a pinched nerve, if you will. Sometimes people develop a bursitis. There's a little sac, a fluid-filled sac that gets inflamed. It presses on the nerve, and then you have this, excruciating pain going down the arm. Well, the treatment is that band, that tennis elbow band that you can pick up at any pharmacy, ice, anti-inflammatories, and rest. Similar to symptoms of sciatica. It's the same physiology that happens in the sciatic nerve, which is located in the buttock area. For people maybe that are, doing things and exercises and movements that maybe they're not used to, what happens is there's a muscle that goes across where the nerve comes out in the pelvis. And that muscle goes into spasm. It presses on the sciatic nerve, and it causes excruciating, what we call radicular pain down the leg. And the distribution comes from the butt around to the top of the leg and down. And the treatment, again, anti-inflammatories, heat, sometimes with ice. And the reason that I say heat is because oftentimes in this situation, there's a muscle spasm that's pressing on the nerve. And a lot of times, heat will help to increase blood flow to kind of relax that. And then rest, basically. Sometimes steroids, sometimes a steroid injection is recommended. But over time, it will get better. Now, how to differentiate sciatica from like a herniated disc in the back? Sometimes it's very difficult to differentiate, but you always want to make sure that you preserve strength in the lower extremity. So if you note that the leg is weaker for whatever reason, or you try to come up on your tiptoes and you just can't do it on one side, that would be a tip-off to get in to see your doc. Go to the ER, find out what's going on. Do you have a herniated disc? Is there something else going on? But for the most part, the sciatic nerve pain, is exactly what I said, and it gets better within a few days.
Before you had said sciatic, I was taking notes, and I heard that because Edie from Mesa was asking. I have constant sciatic problems.
Really?
52-year-old female. My doc gives me Carisoprodol and Tiger Balm for treatment. Is there anything I can do to avoid getting this, or is there a better alternative for treatment?
You know what? There is. Okay, the Carisoprodol basically is a muscle relaxer. So Soma, Soma, Flexeril, Norflex, Skilexin, these are the different types of muscle relaxers that we definitely recommend because, again, it's that piriformis, the muscle that's in spasm that's pressing on the sciatic nerve. Anti-inflammatory is good. The Tiger Balm is really more of a topical, something that'll help just kind of warm the muscle, like a Bengay, kind of a topical. Heat is good. Ultimately, a steroid is something that is recommended, even a steroid injection into the area to decrease that inflammation. But, we try a Medrol dose pack sometimes just to see if by mouth the steroid will help to decrease that inflammation, and that tends to work pretty well. And then physical therapy is another great modality that we recommend because a lot of times, unlike, a neck or, or your arm or your shoulder or your back, when you're dealing with the muscle that is responsible for going into spasm, causing sciatica, it's very deep. So a lot of times physical therapists have access to that deep ultrasonic type mechanism that'll relax that, kind of get the heat into that muscle. It's an ultrasound, modality that helps to relax that and break up that spasm.
When my wife gets that, I don't know what she takes pill-wise, but I take my massager and I massage the area, and then we sit in the hot tub.
Yes, exactly.
And that seems to make her feel a little better. It always takes 3 or 4 or 5 days to get over it, but
acupressure, pressing on that area, massaging it. Acupuncture is another modality.
I'll tell you what, I've been getting that once a week, and whatever the issue is, I've been trying to cure my wrist, but it makes it feel better for maybe a day.
Yeah.
And then it comes right back.
Right. And that's a good point, Joe. A lot of times acupuncture really is a symptomatic treatment. If there's an underlying, for example, carpal tunnel process or, a cyst or, whatever, if there's a structural process going on, acupuncture is not going to, take care of that.
Right.
It'll help with the symptoms. And it'll help with maximizing blood flow and helping with the healing properties in the process. But if something else needs to be done, that's why we recommend using it in tandem with standard, medical treatment. It's not a standalone modality, and that's, I think, important.
Let's see. We've got a question on the chat. What's the best way to treat plantar fasciitis?
Okay, good. That's a great question. Plantar fasciitis, for those listening, is an inflammation on the foot. There's the plantar aspect of the foot is inflamed. The fascia, which is a covering over the tissues, the ligaments and the tendons of the foot, gets inflamed. And anytime, this is just a rule of thumb, anytime you have a diagnosis that ends with itis, that means there's an inflammation. So, we recommend treating that with an anti-inflammatory and ice. Those are the two mainstay treatment modalities. And, we had talked about treating this in the past. If you get a bottle of water, for example, put it in your freezer, freeze it. It's a great way to put your foot and just roll your foot over the ice bottle. The reason that it's important to roll it, two things. It gives you that massaging effect that really helps to stretch the fascia on the bottom of the foot. Plus, it gives you that ice effect, which will help to decrease the inflammation. And so that's really important. Anti-inflammatories are good. You take a look at the shoes as well. Why are you getting plantar fasciitis? Is it that you're running and your shoes aren't, wrong foot size? Do you need to get fitted for a good pair,
I'm not quite understanding what this is, but I'm sorry.
Do you wear heels that it's basically straining the fascia, which is the tissue on the bottom of the foot. And so it stretches and it causes pain. And so underneath the fascia, there's tissues and ligaments.
So how do you know you have that? If your foot just hurts?
Your foot hurts.
Is it tight or is it?
Exactly. When you walk on it, it hurts. It's painful. And that's the diagnosis. That's how we make the diagnosis of plantar fasciitis. A lot of times we recommend getting an x-ray to make sure that there's no, Morton's neuroma, no other process going on with the foot, make sure there's no foreign body. Diabetics don't have failing in their feet. And we've talked about that where, you can step on something and have a foreign object in the bottom of your foot and not know it.
Every time I step on something now, I look in the bottom of my foot for a key.
Right. Exactly.
I think that was in one of your shows.
Absolutely. So, it's important, once you roll all of that out and you have the correct diagnosis, which is plantar fasciitis, then that's how you treat it. It can be very difficult to treat. I
always wear slippers. I always protect my feet.
As a diabetic, that's important.
Your key story did it for me.
And remember we talked about white socks, the importance of wearing white socks, so that if you do bleed, if there's an ulcer or something that's seeping, if you have black socks on, sometimes you're not going to see
And
that.
all the good diabetic socks that I found are black.
Are they? Yeah, see,
How funny is that?
That makes no sense,
They need
right?
to change that.
They do need to change that, yeah.
Wow, they should listen to DocTalk
That's a
Radio.
marketing. That's a marketing kind of a thing.
Milty from Florence. A lot of calls from Florence. So, thank you for all you guys from Florence calling out. We appreciate it. Is it dangerous to eat fruits and veggies from out of the country? Or what about eating canned food from China?
Oh, anything canned I would be careful of. So that's right off the bat. We know that there's a high incidence of toxins and those kinds of things that are found in the can, whether it be canned tuna, canned soup. Just be very, very careful of that.
What do you got to watch for?
Well, lead toxicity, different toxicities, that sometimes that are found, especially in children. There was some research looking at because kids, their metabolism and just their body mass index is smaller. It takes a little bit to cause a bigger effect. So there was actually some studies looking at tuna coming out of a can causing the toxicity, and they're finding that it may be coming from the can. Canned soups,
wow.
Those kinds of things. You just have to be very careful.
I hate anything in a can.
You have to be careful of the preservatives and that kind of thing. Out of the country, honestly, I don't know. I would be cautious. There's a lot of different bacterias that can be transmitted.
And from what I heard, the fruits and vegetables from Mexico, and I do believe this, are grown in human waste because of their old pipes, their sewage pipes. They just don't have a good purification system.
And a hygiene system.
That can't be good to eat that stuff.
No, I would be very, very cautious of that. Yeah.
Let's see. What do you know about the super beta prostate supplement in treating prostate issues?
The thing that comes to mind is saw pimento. There's some really good, sound evidence of supplements that you can get over the counter at a health food store for prostate health. The super beta, I'm not sure. I think that you may be referring to the saw pimento. And what happens is usually what we're referring to is benign prostatic hypertrophy. As men get older, the prostate enlarges, and there are different things that can be done to help decrease that inflammation as an anti-inflammatory type of an effect. And saw palmetto has been found to be one of them. Anything really that helps to scavenge radicals as the antioxidant effects and those kinds of things have been found to be very helpful in decreasing inflammation in the body. In particular, benign prostatic hypertrophy is one of the things that have been identified. Oxygen. Let's just talk about oxygen for a moment. There's something called hyperbaric oxygen chambers or hyperbaric oxygen treatment. And in people who have like diabetic ulcers, we were just talking about the feet, oxygen sometimes can help increase healing. And here in the Valley, there are several hyperbaric oxygen chambers that, that people that have chronic wounds, for example, that have a hard time healing. Oxygen tends to increase what we call neovascularization. It increases real tiny blood vessels, the formation of new blood vessels that help bring increased circulation, blood flow to an ulcer or a wound and help with the healing. If you think about an ulcer or a wound, in order to heal a wound, it's got to have blood flow because, blood flow is really what brings oxygen to the area. It helps to remove the carbon dioxide. It's that exchange of oxygen for carbon dioxide. If you're treated with antibiotics, for example, the way that the antibiotic is going to get to the heart of the wound is through the blood circulation and the blood flow. So in people who have very poor circulation, a lot of times it's very difficult to heal an ulcer, for example, on the toe or on the foot. And I say the toe or the foot because that's the furthest area away from the heart. And so the pressure in that area tends to be lower, so that the pressure that's forcing blood out to that area, it's a less pressure system, and a lot of times we don't get enough blood flow in that area. End up with very cold circulation. Your toes turn white or blue, poor pulses, those kinds of things. Well, in that population of people who develop ulcers, what we've found is that oxygen, very high, 100% oxygen, just being in the atmosphere of that 100% oxygen, tends to cause increased neovascularization or formation of small blood vessels in the body that actually increase healing in that part of the wound. So it's called hyperbaric oxygen. Now it's interesting that whenever you go into a hyperbaric oxygen chamber, one of the first things that we look for is we look in the ear. We want to make sure that the eardrum is intact, make sure that there's no wax impacted in there, make sure that there's no perforation of the eardrum, because when you lie in a hyperbaric oxygen chamber, your entire body's in this chamber, it's a pressure system, if you will. And the eardrum is one of the places that can possibly be susceptible to high pressures. And we look at that because if you do have a perforation or an old perforation or something like that, this could actually make it worse. And so just something to kind of keep in mind. It's just an interesting piece of information. If you know somebody that has a wound that just doesn't heal, oxygen might be the answer to it.
And this was designed for scuba divers in the bends primarily,
That's
wasn't
exactly it? Right. That's exactly right. Or even people that have carbon monoxide toxicity. If there's a fire, or for whatever reason you're exposed to that, that's how we treat it, because it rids the level of carbon monoxide in the body.
To take the nitrogen out of your blood?
It does. It helps to decrease that, and it's a controlled environment, and it's a really very interesting treatment modality.
Martin from Gold Canyon would like to know, is it better to drink water room temp or ice cold? That should be right up your alley there. He says, I cut out plastic bottles because of the stigma behind them, not quite sure why.
Great. Okay. Plastic bottles, great. Even we're here drinking this, but that's a really good thing to do. Because of the, some of the benzopyrenes that they're talking about that's found in the environment and can seep in. The recommendation is, don't heat up food in a microwave in plastic containers. In fact, I was just reading an article just before the show, the new recommendations that have come out. Room temperature versus cold. A lot of times it's preference. From a health perspective and standpoint, I'm not sure that it makes a whole lot of difference. There's some schools of thought that say if you drink cold water, what it does is it causes your metabolism to work harder to warm that cold water, and so you burn more energy and you burn more calories.
Oh, wow.
So if you're interested in losing weight, for example, they say, it's probably a good idea to drink cold water because your body has to work overtime to warm it up, in the body. Now, is that, who knows? But that's one school of thought. From a medical perspective, there's really no difference that I can think of. If you are, for example, if you have throat problems, let's say, for example, we were talking about laryngitis earlier, you hollering at the dogs, probably best to stay away from real cold water. Okay, because what that does is anything cold can tend to, it decreases inflammation, but it constricts blood vessels. And there's a constriction there. Heat dilates, cold constricts. And so that's why cold ice tends to, take swelling down, in the tissue. So you may want to avoid the cold water if you have, laryngitis, if you're going to be talking. And even any time you do public speaking, or like you asked me before the show, do I want ice water or room temperature?
Right.
And I said room temperature. The reason is because we're going to be talking, and it tends to sit easier with your voice. I mean, that's a known fact. Singers, again, oftentimes they use a lot of room temperature versus cold.
Robin from Nashville says, is there a good red meat to eat? What cut, certain kind, way to cook? I love red meat, but I have medical problems and was told to quit eating it.
I'm laughing because, my initial response is there is no good red meat to eat. But that's I don't know that that's a completely fair answer. You want to tend, the answer to that, I think, if you're going to eat red meat, you want to make sure that there's an organic, you can buy meat that is organic, that is not being fed chemicals and those kinds of things. But that's really the reason that we recommend, one of the reasons that we recommend avoiding red meats and those kinds of things is because of the chemicals that are being fed to them, the steroids that are being fed to them, those kinds of things. In general, red meat is not good for the body, period. We know that. In fact, there are studies out now looking at people that have diverticulitis or diverticulosis, which is a weakening of the inner lining of the colon, causing little pockets, little balloon out-pocketing. Meat, interestingly, red meat, tends to weaken the lining of what we call the mucosa in the colon. Just simply, any red meat will do that, whether it's organic or non-organic. It's just simply the way the body digests the meat that causes, that strain in that area of the body. And so we found that actually worsens people's diverticulosis, leading to, a higher risk of developing diverticulitis. So, it's hard to say. But if you're going to eat red meat, recommendation is to stick with more the organic. I can't believe we only have a few minutes left in the show. We have a couple more questions. I wanted to share with you an interesting case that I had in the hospital this past week. It was a young guy, healthy, came in, started working out. Interestingly, was at the gym, started doing the workouts where they would do different exercises in different stations, kind of like a routine. And they were doing pull-ups and then push-ups and then pull-ups and then push-ups. So they did a lot of exercise focused on one muscle group. Well, the next day, the guy couldn't move. I mean, he was a 39-year-old, healthy young guy, wanted to work out, started this exercise plan, thinking that into the new year, wanted to lose, 30 pounds. After the first day, muscle soreness didn't get better. Second day, muscle soreness didn't get better. Now, all of a sudden, his urine started turning like tea color and very, very dark. And that's what scared him enough to come into the hospital. And he came in with the diagnosis that we made called rhabdomyolysis. And rhabdomyolysis is basically when the muscle breaks down and there's a big, heavy burden in the body where the muscle breaks down and it causes this, where you can measure the CK. It's the creatinine kinase. It's a blood test. Now, just to give you an idea, 1 or 2 days of a strenuous exercise that this guy actually started caused his creatinine kinase to go, normal is between 0 and 150. His creatinine kinase was over 250,000. And the burden was just an unbelievable burden. And what happens is the molecule sometimes can cause problems with the kidney. it can cause, it can clog the kidney, and it can ultimately lead to kidney damage and kidney failure. So you've got to be very careful to make sure that you're hydrating and that you're getting enough, hydration when you exercise. Especially,
and that's what he did. He didn't hydrate himself?
He didn't hydrate himself. And plus, on top of that, he was starting this creatine kinase protein type supplement. And you've just got to be very, very careful. Ended up, he did great. We hydrated him. He was in the hospital for 3 days, I think, on IV fluids. Kidney function, we preserved. Kidney function never really became abnormal, but we just monitored that number, and it just started coming down. But it's just something to kind of be aware of. If you're going to start in the new year some exercise programs, it probably is a good idea to pace yourself. Don't jump in and just do too much at one time. Just gradually get yourself in an exercise program. Make sure that you hydrate, and try to avoid a lot of the the supplemental creatine kinase kind of stuff that
like the powdered protein drinks and all that.
Powdered protein is okay, but there's some other things that are added to it that you've got to be careful. And I would really recommend that you talk to somebody, whether your doctor or somebody, to make sure that you're okay to do that.
Just not the salesman in High Health.
I would be careful. I would be really careful.
We have 2 questions left.
Okay.
I think they're pretty good. Let's see if we can't get through these. Nellie in Fort Lauderdale says, is it better for health to eat peppers and spicy foods for your body? And I have heard that Himalayan salts are actually good for you.
Yeah, there's a lot of good antioxidants that we get from different peppers, and so yes, I mean there's some really beneficial effects that we get. I don't see anything that is detrimental to the body. Some people, who have like ulcers or gastroesophageal reflux, sometimes those spicy type foods can exacerbate that. But for the most part, I can't think of anything where that would be a problem.
What about the Himalayan sea? I want to say sea, but Himalayan salts.
Any kind of salt I would be careful of, especially if you have a history of high blood pressure. Whether it's Himalayan salt or sea salt or whatever, you've got to be careful because salt causes water to follow it. So that if you're taking a lot of salt, water is going to follow it. It's going to cause a increased vasculature, and it can actually increase blood pressure. That's why we talk to people who have high blood pressure and say you've got to limit low salt diets. You've got to be careful of taking in too much salt. Now, if her question is Himalayan salt better than regular salt, that I don't know.
Now, she said she was reading or under the impression that you should eat it because it's good for you.
Yeah, I don't know. I would be very, very cautious of ingesting too much salt, within reason.
Brad from Baton Rouge, Louisiana. Is pork okay since it is white meat compared to fish, chicken, and turkey?
Pork is okay. You've got to be careful. People who have a problem with digestion, let's say we were just talking about diverticulosis. Pork, the body reacts to pork the same way that it reacts to red meat. So I would be very, very careful from that standpoint, from a digestive standpoint. Now, if you're asking me, is pork better than fish? My answer to that is no, not necessarily. I'm not saying that it's worse, but I don't think that it's better. In fish, there are things that we get from fish that is very, very healthy, like the omega-3 fats, that you don't find in, pork and those kinds of things. So, there's a balance. And I think anything in moderation is okay. You just have to be careful. You have to be careful not to eliminate something like fish and replace it with something like pork, because you're not going to get the same health benefit and nutrients that are found in the fish and the salmons and those kinds of things. So I'd be cautious. Joe, we're over time.
Wow.
There was a lot of stuff that I wanted to go through.
We got some great comments on the chat too. Great show.
Good. Well, tune in. We have some great shows coming up. We're going to have a heart surgeon as a guest coming up. So I'm going to be trying every other week to do have a guest on one show on 1 week, and then I'll be doing kind of a question answer.
Nice.
So it'll be fun. Check us out on Facebook. I'd love to have you join in. And until then, we'll have a great week. We'll talk to you later.
All right, DocTalk Radio. And we are out another week.
This concludes DocTalk Radio with Dr. Ann Borik. Till next time, I wish you health, wellness, and many blessings.
DocTalk Radio is brought to you by Gilbert Hospital and Florence and Anthem Hospitals. Topics discussed are for informational and not intended to substitute advice from your personal physician.